Ideally, of course, we would be structuring policy that is taking in mind the risks of those who are highest risk. But given that a decision has been made to open everything up and likely remove mask mandates, et cetera, I would tell my patients to do whatever they can do to mitigate their own risk. So that means get your vaccine if you haven't had it, dose 1, 2, and we know that immunocompromised people need a third dose in that first series. And in fact, many now are eligible for a fourth dose. So ask your practitioner whether you should be getting that fourth booster dose. I would also tell people to be still adhering to all of the social distancing guidelines. So when you're thinking about gathering in groups, to make sure that if possible, those who are gathering with you have done the rapid antigen testing to determine that they don't have COVID, that they're masking, so that even though you're going into a place where there may not be a mask mandate, to be taking care of yourself and wearing an N95 or a surgical mask or a KN95, and to be really paying attention to your own symptoms and getting a supply of the rapid antigen test, so that if you do actually experience these symptoms, that you seek help and test positive, that you get help very quickly, because we know we have good therapies now, and a priority will be for those who are immunosuppressed.
In order to keep society safe and open, in order to keep businesses and restaurants safe and open, undoubtedly, we need to upgrade our vaccine certificate program, but we also need to do a much better job at acknowledging airborne transmission of COVID-19. So what that means is that our government can definitely procure N95 masks rather than just surgical masks and give them out to anyone who needs them. Unfortunately, even in healthcare settings, in some situations like in home care, we don't have health workers who have access to N95 masks, and that's just a travesty. That should not be happening. And definitely, we should be providing N95 masks to anyone who is immunocompromised or anyone who has a higher risk of getting infected or seriously ill with COVID-19. And in addition to that, in businesses and workplaces, especially in these high-risk indoor settings where people could be congregating and could be with others outside of their household, what that means is we need to improve air quality standards. We need to provide businesses with money and support so that they can purchase HEPA filters, improve HVAC systems. Anything we can do to improve ventilation will mitigate our risk of COVID-19 and once again allow society to stay safe and open.